Hello again, I'm Dr. Jim Collins. My topic today, how healthcare professionals can help victims of human trafficking. And if you've been on Collins Learning, CEU Academy, or my blog, you know that this is one of those areas that I became intensely involved in. Researched it, read a lot about it, put together programs, continuing education programs, workshops, delivered it in multiple states throughout the country, and have posted many things online and have courses on our learning management system. So it's only within the last decade or so that human trafficking has gained enough attention that healthcare professionals are actively learning more about it, researching it, and they now can do something about it. That's the important thing. You could know everything under the sun, and if you don't do anything about it, it's worthless. Human trafficking is a global, national, state, and community public health issue. Becoming more aware of the problem, recognizing the signs in order to identify trafficked persons, and knowing what to do next may free people and may save lives. Important stuff. Human trafficking, what is it? Helping people starts with understanding the problem. Human trafficking is a modern day slavery. There's no pretty way of saying this. It is a horrific crime against humanity. It's the third largest business in the world, second only to number one, drug trafficking, and number two, weapons trafficking. Drugs, weapons, humans. Human trafficking many times involves commercial sex induced by force, coercion, or fraud among individuals under the age of 18. But it also includes a wide variety of other activities. Recruitment, transportation, harboring, or obtaining of people for labor or other services through similar means. In farming, agriculture, factories, sweatshops, restaurants, nail salons, it goes on, hotels, it goes on and on and on. Now, why do I talk about healthcare professionals? Healthcare professionals, human trafficking, there's a very unique intersection between the two, meaning that they meet, and they meet frequently. Healthcare professionals are in a very unique position to come into contact with trafficked people, as they are likely to use the healthcare system at some time during their captivity. In some instances, the healthcare provider is the only person they may interact with outside of their captivity. Unfortunately, many healthcare workers may treat trafficked persons without knowing their circumstances. There may be very subtle cries for help that go unnoticed. Signs and symptoms of trafficking may be missed completely and altogether. This is why it's critical for healthcare professionals to obtain as much training and education as they can in human trafficking. And what I'm hearing around the country is it's now becoming mandatory for nurses in certain states where trafficking is very high. It should be, I think, mandatory for social workers soon, physicians, administrators in certain states. So let's move forward. It's important to use your gut instinct. Generally speaking, your gut is not wrong. And there's a big reason why. Your gut has more microbes in it than your brain has cells in it. And the gut talks to the brain all the time. Gut instinct is not this made-up term. It's real. One of the only ways to identify a trafficked person is to have the issue right here at the forefront of your mind as much as possible. In other words, be ready to diagnose human trafficking. I've actually heard that the ICD, the latest version of the ICD, may have a human trafficking diagnostic code in it. Be on the lookout for vulnerabilities like cultural and language barriers, being a runaway or being homeless, having a substance use issue. Is prostitution a part of the picture? Are they in control of their own money? And who has their personal ID? Do they? If they don't, red flag. Are there signs of sexual or physical abuse? Are they exhibiting anxiety, depression, or PTSD? How about expressing a lot of somatic complaints? Do they have unusual tattoos indicative of being owned by somebody? Okay? And when are they seeking care? This is very, very important. Many times a trafficked individual will seek care when their health condition becomes very serious or life-threatening. They may also present at an ER when their injuries prevent them from working. They might need contraceptives to get back to prostituting. They might need things to prevent pregnancy. They may need an abortion. I mean, this gets dark. It gets really bad, very disturbing. They might need to be tested for sexually transmitted diseases. Some will seek care, some females, for vaginal trauma, pelvic inflammatory disease, or toxic shock syndrome. This is not a light topic. Bear with me. What to do next? This is what is probably ultimately the most important takeaway from today's talk. Once the person has been identified as a victim, I hate to use the word victim, but you know what I mean by it. This is a trafficked person. They have now been identified. It is time to begin the treatment process and report to the appropriate authorities. Do you know who to report to? I mean, 911 is quick and easy, but there are hotlines, there are nonprofits to call, and this is certainly easier than done, as it's going to involve a multifaceted, interdisciplinary, and a holistic approach. To begin with, safety must come first. This means to make sure that the trafficked person is safe, that their pimp or trafficker is not nearby and listening to everything and trying to drag them out of the treatment area. For healthcare professionals, I would say make sure that you are safe. Empathetic communication without confrontation can be very effective in gathering important information about that person's situation. Ask for an interpreter if they don't speak English. Get help from social workers, law enforcement. Contact local nonprofit agencies that specialize in human trafficking, and they know what type of services are available. Document everything as you can, as accurately as possible, and as thoroughly as possible. That document might end up in court, it might end up with law enforcement, it probably will. Let's just say it probably will. So it's got to be good. Here's my takeaway. Human trafficking is a real problem that affects almost every state in the United States of America. Besides law enforcement, healthcare professionals are the most likely individuals to encounter a trafficked person. It's important to continue receiving as much training and education on human trafficking as you can in general, but learning how to identify a trafficked person can mean the difference between that individual returning to slavery or being treated properly, taken away from the world of slavery, and learning how to identify a trafficked person might actually mean the difference between life and death at times. This topic is very, very heavy. It's very serious. So keep learning, please. If you're a healthcare professional, if you're in law enforcement, if you're in education, training, and other areas, learn as much as you can. When I started to get into this, I got in really deep, And it affected me. I got very dark over this. And my wife actually started hiding my books, taking them away. I couldn't take them on vacation. After I got out of my dark slump, I got angry. I got really, really angry. And I decided to do something about it, like education and training and spreading the word as far and wide as I can. And that's what I'm doing now. So thank you for watching, and please forward this to a friend or a colleague. I'm Dr. Jim. Take care. I'll talk to you soon. Go Pro.